Happy Monday, everyone. I'm here with Dr. Daniel Roney. He's our chiropractor who works with us on a functional medicine capacity, and you're going to learn all about him today. What we wanted to tell you is to spread the word. Community is healing, and every Monday at 4, we'd like to share our community with you and your family and your friends. So please today enjoy Dr. Daniel Roney.
Thank you, Kitty. Okay, gang, so today we're going to talk about chiropractic, and the title is The Magic of Healing Through Chiropractic. So one of the things I want to discuss, early in my career, when I first started, I had sports medicine background, chiropractic background, physical therapy background, and I incorporated all those into my clinic. We did a really good job getting most people well, but there was a segment of the population that I was seeing that wasn't getting any better. And what I mean by that, they would get better that day and feel better, but as time went on and I did reevaluations, say every 12 visits or 18 visits, they really didn't improve much at all. So a lot of people did, but there was a segment of the population that just didn't improve. So what I started to see on their intake forms that was consistent were problems with their metabolic system. So a lot of these patients that didn't get better had autoimmune conditions. They had digestive system issues. They may have had blood sugar instability, thyroid malfunction, adrenal malfunction. Some had anemia, hormonal imbalances, etc. So the point I'll make real quick is their musculoskeletal system wasn't getting any better because their environment was not conducive to healing. So I was basically band-aiding these patients, and it wasn't adequate for me. So what I decided to do with that experience is go back to school and learn about these metabolic issues in functional medicine that could help heal patients that weren't getting better chiropractically. So it was kind of that I wasn't happy with not getting people better, so I knew there was more to the story. So to keep it simple, I was doing step B with those patients, right? Getting them pain relief, helping their mobility, etc. But I wasn't doing step A, which they needed cellular healing. So went back to school, learned, and now I integrate everything into the practice. So what I want to do, hopefully that makes some sense. What I'd like to do is talk to you a little bit about each example of a patient that comes to see me for chiropractic care, all right? The first patient that comes to see me is somebody that may be structurally sound, meaning they have good alignment, they have overall pretty good health, they don't have a lot of the metabolic issues that I mentioned, and they just woke up one day with a stiff neck, or they lifted something out of their trunk, or something like that, and they just have this kind of one-time issue. So with that patient, when they come in, we still evaluate everything, we rule out some of the bigger things, and then I start working on them. We could do stretching with that person, we could do some physical therapy modalities, and the objective is to loosen up their muscles, stretch their muscles, help with some pain relief, and then loosen up the joint itself. You know, just as an example, here's 2 vertebrae in the neck or the low back, but the idea is the things that attach to this have to be loosened up in order to get an easy manipulation or adjustment. So we do that, we work on adjusting them, and at the end of the day, the proven, outcomes that we want from a chiropractic manipulation are better range of motion. So one of the things that happens with better range of motion, it creates the best healing. So motion is critical for those inflamed muscles and possibly the ligaments and joints to heal. The second thing that it does, it helps with pain relief. So just real quick, not to get too technical, but there's a theory in therapeutic modalities called the pain gate theory. If I put mechanoreceptive input, which is just stimulation into the spinal cord to the brain, it basically runs on a very fast nerve fiber. So when I manipulate the spine, that mechanoreceptive input at a certain area of the spinal cord called the substantia gelatinosa lamina 7, don't need to know that, but it basically blocks pain from getting to the brain. So the chiropractic manipulation is also designed and proven to help with pain relief, okay? The final thing that it does, and there's more, but that I'm going to touch on today, is it actually increases your immune response, okay, in a good way. So it creates better healing through increased white blood cell production. And those three things have been proven with the chiropractic manipulation, okay? So that person, as an example, they may need a visit, 2 visits, 3 visits. It just depends. It's difficult to say, but that person will probably be out of pain relatively quickly. That's a short-term patient that doesn't need a whole lot of extra help. Do you need help?
They're telling me to turn it up. We're
Okay.
going to turn this.
Sure.
We're going to try to do this, Dr. Make sure that the sound is up. Let us know,
Pretty good?
everyone, that the sound is up. Okay, go ahead.
Are we good?
Again.
Hopefully I'll talk a little louder. That way if there's a problem, I can do that.
Yeah.
All right. Good? I think? Okay, so that's patient example number 1 and some of the things that we could do for that patient. Patient example number 2 would be somebody that has a chronic or long-term issue, whether they complain about neck pain over the years or low back pain or what have you. Maybe they've had traumas over the period of their lifetime, and they're in quote-unquote chronic pain. That person we want to evaluate a little bit more rigidly. And what I mean by that is I want to make sure that the alignment of their spine, and we do this with posture, we could always get x-rays as well, but mainly we want to make sure that their alignment is not contributing to the abnormal loading stress of the spine. So what I'd like to do is kind of explain that, and if Kitty could help me, it'd be great.
Okay.
All right, so what I'll explain here is when we look at normal structure of the spine, and I'm going to use the spine as an example too. We want to see from front to back, we want to see a nice straight alignment, okay? So how we determine that via posture, we look for the ears and the shoulders, right? And we want to see them even. So sometimes you'll see tilts, right or left, okay? Sometimes you'll see rotations, and sometimes you'll see what they call flexion and extension views, okay? We also then want to look at the shoulders and look for the same things, okay? We work our way down, and we want to look at the hips. Sometimes we'll see hips that are rotated, okay? We'll see flexions, rotations, what they call lateral flexion, forward flexion, extension. So we're looking for all these different alignments that could contribute. So let me explain real quick. If a car is out of alignment, the tires are going to wear abnormally somewhere. So when we look for these chronic conditions, somebody that's in chronic pain, we want to rule out that these alignments, and there's more, I'll show you in a second, are not also contributing to their chronic pain. Because here's what happens. As you abnormally load the spine, okay, and you have that abnormal stress, you're going to put excess pressure on areas or structures like muscles and ligaments, bones, discs, nerves, etc. They're all very pain sensitive. So that abnormal loading stress daily is going to create a chronic problem. Hopefully that makes sense. Okay, now from the side, this is one of the keys as well. So when we see somebody front to back, just real quick, and they're way off, that's usually somebody with scoliosis, by the way. Somebody has an S shape from front to back. So it might look like this, and thereby throwing off the hips, the shoulders, etc. One of the main areas that we really want to look at is from the side. So we want a nice 34 to 38 degree curve in the neck. We want to make sure the thoracic spine is not way forward and to what they call kyphotic. And then we want to make sure the lower back is not shifted or the pelvis is not shifted anteriorly. Okay? So what that looks like is ear over shoulder, shoulder over hip, hip over ankle. So that's what we're looking for. Okay? Some of the more common, I'll put this down. Yeah, and some of the more common things that we see are rounded shoulders, forward head carriage, and then the hips shift forward. So it looks kind of like this, okay? All right? Now, here's what I want to talk about as far as misalignments of the spine. Typically, a lot of people think that the vertebrae misalign one on top of each other. What they really do is they get fixated from tight muscles and things like that on top of each other. The bigger alignment issues happen as a result of shoulders getting forward, head forward, and then the hips anterior pelvic tilt. That's called global misalignments. Okay, that's how the spine misaligns. And the reason they do that is because, number one, gravity's working on us constantly, pushing us down. Okay, that's number one. And number two, we don't do anything to counteract that. So these muscles get weak, and when they get weak, they get longer. And when they get longer, the origin and the insertion, right, get further apart. So I start to do this. Hopefully that makes some sense.
Does that
So,
make sense?
yeah,
Okay.
yep, thank you. The key to that, though, is if we want to get structural correction in that person, we have to reform the muscles and the ligaments. So I have to identify, usually it's tight muscles in the front, right? We're really tight here, lowering our lung capacity. That's a big deal because we don't get enough oxygen into our system. And then we want to make sure that the posterior muscles are strong. So I'll use an example. If I want my shoulders to go from this point to this point, right, that good structural postural position, I have to stretch the front and I have to strengthen the muscles that attach from the spine to your wing blades. If I do that, the wing blades are going to come back this way, and that's helping correct the structural abnormality. If I wanted to get the neck over center, the ear over center, I then have to do the same with the muscles that we just talked about, origin, insertion. I have to strengthen them to get that origin closer to the insertion point, okay? Now what I've done for a person, I've taken away that abnormal loading stress that's creating chronic stress to the pain-sensitive structures. So now I can help them in another level other than just a light manipulation, which we do because they're going to be fixated. This is the person a lot of times that says, oh, I have to crack my own neck or my own back. The reason they have to do that is because they're getting abnormal loading stress constantly that causes the vertebrae to fixate and not move properly, which is a whole, creates many other problems, okay? So we manipulate that person, we stretch them, strengthen them, manipulate, and work on getting mobility, but we really want to work on getting that structural correction. So that's a level 2 patient, I call it, okay? Hopefully that makes some sense. Now, what I didn't touch on is the part of this that creates tension on your nervous system. So they've proven that when I start to forward head carriage or get forward head carriage like that, the spinal cord becomes stressed and there's tension on the spinal cord, which is proven to cut down nerve flow from the brain down to your spinal cord out to your tissues, cells, tissues, etc. Okay? So when we're talking about healing, your spinal cord and your brain, because of the electrical currents that they charge or they put out, you don't want tension on those areas when your body's trying to heal. Every cell, tissue in the body is under nervous system control. So if as an example, if I do have some stress on my spinal cord, it's kind of like a kink with a hose in it. A kink with a hose in it. A hose with a kink in it. That's supposed to be funny. All right? A hose with a kink in it. The water is not going to get below that kink very well. There might be some water, but really we want to take that kink off the hose and create that electrical flow that creates optimal function or optimal energy at the cellular level. So that's a tie-in to how chiropractic care is very, very good for healing. Now, is it the only thing? No. But the way we look at things here at the Center for New Medicine is what can we do for a person that's trying to heal, right, that minimizes their downside. That's the whole key. All these different modalities, all the different things that are researched, how can we apply them so you have the best chance of getting better? And chiropractic care is a big, big factor in that healing. So that's part of what I wanted to get the message across today. Now, a third part goes back to the story that I told initially, is I evaluate every patient that I see metabolically as well. And we look for issues with their stomach, their small intestine, their colon, i.e. their digestive tract. We look for issues with their liver and the ability of their liver to what they call biotransform, meaning how can I get these toxins to transform into fat-soluble material so it's out of the body, right? So water-soluble, fat-soluble, out of the body, all right? Or fat-soluble to water-soluble, sorry about that. So then what we want to do is also look at their blood sugar. It's a major, major factor today called dysglycemia, where you get elevated blood sugar and you get tired after you eat, maybe your insulin levels and your glucose are going up, or you get low blood sugar, where that's the hangry person, right? They get jittery, shaky, irritable when they don't eat. Either one of those creates a massive amount of inflammation in the body that causes chronic disease, just as gut issues do, just as the liver, inability of the liver to get rid of toxins. So those three things are critical, but then we also want to look at areas of the body like your thyroid, your adrenal glands, hormonal imbalances, right? We want to look at, do you have autoimmune conditions or immune dysregulation, etc. So the idea is then we want to evaluate you metabolically, because those are the things that I just mentioned are the known causes to chronic disease, okay? So you have your chiro, your general chiro care, you have your structural correction chiro care and how that helps. But in essence, from a healing standpoint, we've got to make sure we understand the root causes of your chronic disease, if you have one, and then we have to go and start correcting all those. So that's where over the last 15 years I went back to school and learned about those things so I can actually help somebody heal based on their cause and effect. So chronic disease is just the effect. The cause sits right there with all those things that I've just mentioned, and that's almost every patient that has some type of chronic disease, cancer that we see here being one of the biggest ones. Almost every one of those is going to have autoimmune or some type of immune dysregulation. They're going to have gut issues, thyroid issues, adrenal issues, hormonal imbalances. You can almost guarantee they're going to have those things in their history, which is creating abnormal, right, cellular function, which then causes these abnormal chronic diseases to occur. So next week, the follow-up is going to be on these functional medicine concepts and the causes to chronic disease. Okay? So I'm going to open it up to questions. I'm going to sit down and I'll open it up to questions. I'll keep my spine on my lap so we can. Okay, questions.
So does chiropractic care, you have to repeat, how does it help? You went over certain diseases. A lot of people worry about, does it hurt?
Okay, good question. So the question is, does chiropractic care hurt? All right, now, it can if the right things aren't done before the manipulation. And what I mean by that, think about this. If you come in and you're real tight, your muscles are real tight, think about where those muscles attach to. Say your neck is real tight. The muscles attach to the vertebrae. So if the muscles are tight, you're going to have less movement in those vertebrae, if that makes sense. So you're going to have fixation. So before I manipulate, I need to stretch those muscles. I need to lengthen them. I need to do things that allow them to relax, whether that's stretching, massage, some type of, there also physical therapy modalities can be done to help loosen up those muscles, even heat them up, okay? Once I can get them to relax, I get in and we do a light manipulation to help the vertebrae get more motion, which is going to help the healing, okay? It's also a good pain reliever like we talked about. So though the manipulations can hurt, if the right things are done before by somebody that's really knowledgeable about what they're doing, the manipulation should hurt very, very little, okay? And I hope that answers the question.
So some patients have said, ask if chiropractic care is dangerous.
Okay, yeah, great question. So, yeah, the question was, is chiropractic care dangerous? And I know there's probably some stories out there and some things that are heard. They're more opinion than anything, and I'm going to tell you why. The one thing that I could tell you, malpractice insurance, right? So as an example, some clinicians, anesthesiologists, and sometimes, orthopedic doctors that are doing surgery, things like that, they're six figures. Could be $100,000 plus, just as an example. Our malpractice insurance is roughly around $2,000, $2,000, $2,500. What that means is there's not a whole lot of people putting claims in for injuries against chiropractors. So as long as it's evaluated properly, the person's evaluated properly for any contraindications to adjusting, as long as a thorough history is done, as long as the right workup is done, it's very, very safe and very effective. But like anything, you want to feel comfortable with the person that you're working with. You want to ask them, what do they do as a workup? What do they do before the adjustment? What's their technique like? Do they go easy? Do they put in a lot of force? Ask those questions and then feel comfortable with the person that you're working with, and you'll be fine. It's very, very safe overall from a therapeutic modality.
So what happens with your spine when you're overweight or you lose a lot of weight? Could you go over?
Okay. So the question was, what happens to your spine when you're overweight or when you also lose a lot of weight? Okay, so this is a good question. If you think about why our spines misalign, the number one reason it misaligns is because of gravity, right? So gravity is a force that works on us and it's pushing us down to the ground, right? Hopefully that makes sense. If I am overweight, I'm increasing the force of gravity on my joints, especially my spine. So you're going to get excess, what they call compressive load, and you're going to have a harder time because of the weaker muscles holding that spine in place. Okay? So what's going to happen is you'll go out of alignment. Remember we talked about maybe the shoulders rounded, the forward head carriage. That's going to happen probably faster because you're increasing the loading stress. Okay? Now, if you lose a lot of weight and that spine's been in that position a long time, now you're going to have the weight off, but you're still going to be stuck in that abnormal postural position. So that's somebody that really needs to get to work on lengthening, strengthening the structural correction aspect of what we talked about, the second example that I used. So hopefully that gives you a little bit of an idea. Weight is an excess stressor to the spine. I mean, of course, to the body in general, the heart, etc. But it's also going to create worsening postural positions because of the force of gravity is going to be increased. Okay? Is that helpful?
Yep, very much.
Yeah,
so.
yeah.
Can you tell us, putting you on the spot, on sports medicine and
Yeah.
what you offer
Yeah.
for that?
Yeah, so the question was, talk a little bit about sports medicine and chiropractic care. So I'll tell you the quick version of the story. When I was in school, I was an athlete, played baseball, I wanted to work with athletes. That was my initial goal. So I was an athletic trainer, graduated, went back home. I was in South Carolina, went back to the Northeast and was trying to figure out my direction. Well, I talked to a couple people that I knew. A girlfriend of mine growing up, her husband was a chiropractor for the Philadelphia Flyers. So he was loving it. He said, this is what you need to do. It's the future. So I went to school to become a chiropractor because I knew we could do manipulation and I knew that was a trend that was going in the right direction for athletes, as well as the physical therapy modalities in sports medicine, etc. So long story short, I wanted to incorporate that in there. Now, the biggest thing that I will tell you with structure of the body, structure is always going to dictate function. So when you're talking about sports, the biggest thing that we want to do is prevent injury in sports. If their alignment, and it could be their hip rotation, their knees, their ankles, spine, shoulders, etc. If the alignment is abnormal, the kinesiology, if you will, the movement of that joint is going to be conducive for higher chance for injury. So remember, structure dictates function. So we have to look at an athlete in a way that they almost have to be perfectly aligned. They have to have the right, what they call antagonist muscles that have to be fairly equal. And that's going to allow them, to keep it simple, the least chance to get hurt. Now, training plays a big part in it. We're learning more and more in the training that, if we just sit and put 400 pounds on a squat rack and go up and down, that's good for strength, but we're shortening muscles. We're shortening ligaments. We're not creating pliability in those ligaments. So now, yes, it's okay to do that, but we have to incorporate things like jump training and plyometric training and training that's going to allow the ligaments and the muscles to elongate, to be pliable. So that way when they're put under stress in a sports environment, in a athletic competition, they're not susceptible to tearing because they're so dang tight. So that old school mentality of throwing 400 or 500 pounds on a squat rack, deadlift, and all that, and just doing that is almost out the window now because of the tears in the ACLs and the amount of injuries that we have. Now it's multiplanar movements. It's elongating the muscles, elongating the ligaments, allowing the joint to be very pliable, and powerful too. So there's power and strength, and not to get into it too much, but we want to, with those sports athletes, we want to make sure they're powerful, they're long, right? Their ligaments and tendons are pliable, and the muscles are long. So we call it stretching and lengthening. So I know that's probably a little tangent, but that just gives you an idea of, from a sports standpoint, structure is always going to dictate function. Okay, so we really have to be sound structurally, and then we have to have good flexibility, pliability, and mobility in those joints to reduce injury.
Dana asked, do you use the network or soft touch adjustments?
Okay, so I'm more hands-on. So they asked, the question was, repeat it?
Do you use the network or soft touch adjustment?
Yeah, so network or soft touch adjustments. I'm a hands-on person. So soft touch is what I use personally. And it's not saying that any other form of manipulation or chiropractic is good or bad. It's just what I'm accustomed to. So I like to get my hands on people. I like to manipulate muscles and joints and lengthen and strengthen and do all those things with my hands on them. Hopefully that makes sense.
How does the clinic work with sports medicine as a program? Like,
Yeah.
integrated with you,
Yeah.
practitioner, hyperbaric?
Yeah, sure. No, great question. So the question was, how does the sports part play a factor? How does the Center for New Medicine help with sports medicine or sports injuries or optimal performance? Okay, so the greatest thing that this clinic offers is the number of modalities that are conducive for a person, an athlete, to recover. Okay, so let me explain. Recovery is all about low inflammation. So one thing we do with athletes is we work with them specifically on their metabolic system. Are they getting the right nutrients? So there's testing that can be done for that. We do genetic testing on them to make sure that they don't have any of what they call these polymorphisms in their genes that won't allow them to break down or utilize certain nutrients. We put them on anti-inflammatory diets. We work with them, generally speaking, metabolically, to rule out any of the things we talked about earlier, but also to make sure they can recover very, very quickly. So inflammation in the body is the number one way an athlete will not recover, will wear down, and will increase their chances for injury. Structure and function are the second part. Having said that, the other part beyond us doing that for, or helping them with that, their diets, the supplements, etc., keeping the inflammation low, their workouts that we just talked about, how to keep them long and pliable, right, mobile, flexible, etc., powerful, is recovery. So the clinic, from a recovery standpoint, is phenomenal. So I'll just list some things they have. Hyperbaric, right? So if you're not familiar with hyperbaric chamber, a hyperbaric chamber increases oxygen. It's pure oxygen to the body under pressurized environment. So you get this pure oxygen in your system. Oxygen, blood flow, and reduced inflammation is how you're going to recover quickly. So that's one. There's PEMF, we have Beamer therapy, we have PEMF, which increases vasodilation and vasofunction, meaning we get better blood flow, which means you're going to get more oxygen and you're going to get more blood to the tissues that are trying to recover. So in short, there's a long list of these, right? A long list of these modalities. Ozone therapy, there's IV therapies, etc., that we can incorporate with an athlete to help them recover. So here's one thing, being a former athlete, that's the most important aspect. Two, really. Number one, are you as good on the last day as the first day? That's most important, right? Because as the season goes on, we get usually weaker, we get less, we get tired, etc. It doesn't have to be that way if the right formula is applied. The second thing that we have to be on the field, right? So success is all about being there, right? And a lot of times, if we can stay low inflammation, good structure, we can have the right foods in our bodies to keep that low inflammation, and we can recover well, we're going to be as good on the first day or the last day as we are on the first. So it's a lot of these sports are attrition, right? How can you sustain? Well, I use this example all the time. A guy like Tom Brady from the New England Patriots is 41, I think he'll be 42, co-MVP last year. He's still killing it. The reason he's still killing it is because everything I just mentioned. Is it by chance that he's still playing at an MVP level and he's feeling great enough that he says he can go another 5 years or so, which is unheard of in the football world? Or is it because he's applying a formula that allows for a positive outcome and he's minimizing his downside and maximizing the upside? That's the sports performance type of program that we're implementing here at the Center for New Medicine. Okay? Hopefully that helps. Some more questions?
Elizabeth asked, do you utilize thermography results since that also shows inflammation?
Yes, very good question. It's another modality. Okay, so sorry, I have to repeat it. So thermography, right? Somebody asked if we implement thermography. Without question, thermography is an excellent way to determine if somebody's inflamed, okay? Now, the great thing about thermography is it's very, very non-invasive at all. Matter of fact, it's very, very safe compared to some of the other things that are used. But thermography is an excellent way in order to tell how the body is responding. So the best thing I could tell people is to get a thermographic reading early on in life, and then you have at least a baseline. And then you can get that done at intervals to see if there's changes. What thermography does is it catches issues early, okay? So if we have a baseline and the baseline's good and then we start to see changes, and basically changes mean areas become more red, okay, or more colorful, that tells us that those areas are becoming inflamed. So either there's an issue right in that area or we can become systemically inflamed as well, which tells us that there's issues going on. Thermography is fantastic. We use it all the time. Great question. Anything else? Okay. All right, gang. Thank you for joining. Hopefully you learned something. Next week is going to be part 2, and we're going to talk heavily about the functional medicine evaluation that we do and why it's so important to look at those metabolic factors in trying to determine what causes you may have for chronic disease, or even if you have chronic musculoskeletal issues, we want to look at those metabolic functions as well, because they could be contributing as much or more than the abnormal structure of your spine. Okay? So join us next week.